Hi, it's Dr. Lakia Wright. I'm just going to give it a minute or a few seconds here before I start talking. Let's see if we get some people to log on. So we'll wait just a few seconds to a couple minutes here. And I see some people logging on, so that's great. I see some waves out there. So I will get started. And again, I am Dr. Lakia Wright, so welcome. I am a board certified allergist and immunologist. I'm also medical director of U.S. Clinical Affairs and Immunodiagnostics Division at Thermo Fisher Scientific. I know that's quite a long title. And again, welcome to Allergy Updates, the right now Allergy Updates with Dr. Wright. And what we're going to do today is we're going to talk about anaphylaxis and how to prepare for a food allergy emergency. And so what we want to do really with these videos is really make them educational, and it's really to provide information that you can use to have a more well-informed conversation with your healthcare provider. And so, it's really not medical advice that I'm giving out here, and it's not a substitute for medical advice, but you can use this information to talk to your healthcare provider so that they can give you the specific advice based on your history or your children's history and, your circumstances. I will say if you have any questions, feel free to drop them in the chat, and then I'll get to them in a little bit. I'll take questions or comments. And so what we're going to do is we're going to jump right in, and we're going to go over the who, what, when, where, why, and how of anaphylaxis and how to prepare for a food allergy emergency. So the who, let's start with that. So we're talking about, people who suffer from food allergies. But when we talk about anaphylaxis, we know that it's not just foods that can, it can happen with. It can happen to other things like, venoms or even medications. And when we talk about what, we really want to define, what is anaphylaxis, or what is a severe allergic reaction. And so we want to think about it in terms of a systemic reaction, or something that can affect your whole your body or different organ systems within your body. And so we think about it as potentially affecting your lungs and your ability to breathe. So if you have that sensation of throat closing, or you feel like you can't get enough air in and out of your lungs, then of course that can qualify. And then we also think about it in terms of two or more organ systems. So think about the skin as being like the largest organ. And with the skin, you can see rash. Typically, it would be hives, which are red and raised. And, sometimes it can be a few hives. But when you're going on that trajectory of anaphylaxis, including those multiple organ systems in the progression of it, you can get like 50% or more of your body being covered in the hives. And we can think about also about the gut, as part of that organ system as well. Do you have nausea? Do you have vomiting, diarrhea? Another thing we think about is how you're feeling. Do you feel lightheaded or dizzy? That's a consequence of, those blood vessels dilating and then the blood pressure dropping. And then that can lead to lightheadedness or dizziness. And then some people can even lose consciousness as a consequence of that as well. And then also when you think about the face, you can think about facial swelling, lip swelling, tongue swelling, eye swelling. That could all be signs and symptoms. And so again, two or more organ system involvement, or any sort of respiratory compromise, or feeling like you can't breathe, or that sensation of throat closing. And so let's go over the when. When it can happen at any time. And that's really why we're focusing on being prepared. And again, we have Anaphylaxis Awareness Week coming up. So we definitely wanted to talk about this topic in advance. And that is just coming up next week. So May 4th through May 9th. And so the when, anytime, it can happen at any time. And then after the ingestion of the food, as far as timing, it can happen within seconds to minutes. And, there can be a range from that second to minutes to even up to a few hours. Typically less than 4 hours, but there is one exception here. You might have heard of it before. Alpha-gal allergy, and that's typically red meats, and that can cause delayed anaphylaxis. That allergy behaves a little bit differently. So if you suspect any problems with sort of red meat and having reactions a few hours after eating, you definitely should talk to your healthcare provider about that. And so, well, why does it happen? And really it's happening, we spoke about this in a couple videos ago about, when we talk about food allergy, we're specifically focusing on that IG mediated food allergy. And basically your body, when it ingests something that should look harmless like a food, it's really mounting a response, and really an exaggerated response, and things are going haywire, and you produce those IgE antibodies. And then once those antibodies recognize the antigen or the food, then when it's binding onto your allergy cells, they then trigger the allergy cells to release, and that release of chemicals can occur throughout the body, and that's how you get the symptoms. And so that's really, the why and the what's going on. And then the how, how do you deal with it? How do you treat it? And I want to stress, this is very, very important, that, the first line therapy or the first line treatment for anaphylaxis is epinephrine. Your epinephrine auto injector. We have a saying, epi first, epi fast, when it comes to anaphylaxis and a severe allergic reaction. And that's because we know that epinephrine helps to treat the symptoms of a severe allergic reaction, anaphylaxis. And now that brings me to my second point of, it's really important to know how to use that epinephrine auto injector. And depending on the manufacturer, the instructions may be a little bit different, but I'll go over it at sort of a very high level. And so you want to make sure with the epinephrine auto injector that you have it in the right positioning. You want to know, where the needle is versus where the non-needle end is. And then you want to make sure you're lying down. And the landmark that we look for is, we talk about using the thigh. And then you want it like in between the hip bone and the knee, that outer thigh region. And you want to inject for a few seconds, and then you would be able to release and sort of massage the thigh. Now you have to go over, with your particular epinephrine auto injector, you have to go over the manufacturer's instructions. And it's really good to go over it with your healthcare provider and your pharmacist too, because the more practice, the better. And so there are other types of epinephrine auto injectors. Some even will give you instructions to walk you through the process. So it's really important to be aware of the different epinephrine auto injectors that are out there. And then you can choose, along with talking to your healthcare provider, choose the one that would work well for you. And so I'm going to transition into going over questions or comments. Let's see if there's anything in the chat. I don't see anything coming up now, but what I can do is go over some questions that I commonly get asked. And one of the questions is, can I use a Benadryl to treat, or diphenhydramine to treat anaphylaxis? And no, that's not the primary treatment. So again, I stressed earlier that the primary treatment for anaphylaxis, the first line treatment, would be the epinephrine auto injector. Now, sure, can you give other medications in addition as it's appropriate? Yes. But we want to stress that the first line therapy is the epinephrine auto injector. And remember, I said epi first, epi fast is that saying that we have. And so another question I get asked is, why should you carry two epinephrine auto injectors? So why does it come as a twin pack? So in some cases, you may need to use, after you've experienced anaphylaxis, you can use the epinephrine auto injector, then feel better. And then within minutes, perhaps 10 minutes, 15 minutes, you can get the symptoms coming back. So you always want to have that epinephrine, the second dose on hand, just in case. And once you use the epinephrine auto injector, I also want to stress that you do want to call 911 because you want to get help. You want to have the ambulance, the EMT, and you want to be evaluated by a healthcare provider. Typically you would be going into the ER and they would monitor you. So I think that is a very important point to stress as well. And so another question I get asked, and it's more of a comment too and a question. Patients, I find, in general, they are hesitant to use the epinephrine auto injectors. So, that is partly why, we have an Anaphylaxis Awareness Week. We want to talk about it. We want to normalize talking about it. We want to make sure that patients are empowered and well educated about the signs and the symptoms, and they know how to use the epinephrine auto injector, because we know that epinephrine works very well to treat anaphylaxis. And so that's why it's really important. So the question I get asked is, well, I'm afraid to use my epinephrine auto injector. So can I just, use another medication and call 911? So I always say, you need to, I stress again, like I am in this video, that, epinephrine is the first line therapy. So that is a treatment of choice. And the other things are secondary when we're talking about anaphylaxis. And I will say, if you're afraid to use it, I think talking to your healthcare provider, practicing how to use it with like the trainer device will help you to feel more comfortable, whether you're using it on yourself or your child, or even if you're caring for someone who has food allergies, or who has an epinephrine auto injector for allergies. And so that moves us to my next section, which is Mythbusters. I always have a hard time saying that. And so I'm just going to go over a few myths or comments that we're going to go over and say, whether it's true or false. And so I get, well, doctor, I just have a mild food allergy, so I won't have anaphylaxis, right? And I've never had anaphylaxis, so I won't have anaphylaxis, right? And that's false. We want patients to be diagnosed appropriately. So we want to determine with the clinical symptoms and testing. We want to confirm the diagnosis of an IgE-mediated food allergy, since this is a topic that we're focusing on. So we want to make sure the diagnosis is appropriate. And then once you have that diagnosis of an IgE-mediated food allergy, we know that there is the risk of anaphylaxis, and that's why it's appropriate to have a prescription for an epinephrine auto injector and try to avoid the food, a strict avoidance, but of course accidents can happen. So we don't know if you would just have hives, perhaps like you did before, or we don't know when the symptoms could progress, or if you could have, sensation of throat closed and respiratory involvement, or two-system involvement, two-organ system involvement, like I was talking about earlier. To meet that criteria for anaphylaxis. So that's why we want you to be safe and have that epinephrine auto injector and make sure that it's always available and you know how to use it. So my second one, do I really need to check the date on that epinephrine auto injector? And of course, this is true. You really need to check that date on the epinephrine auto injector, because we want to make sure that it doesn't expire, because we want to make sure that medication, the epinephrine, is active, the ingredient is active, so that it can be an effective therapy. So it's very important to check that expiration date. And I like to tell patients to put the expiration date like a month before, at least in their phone, so then that would trigger them to give their doctor a call. And sometimes the doctor will say, I want you to come in this date and let's review everything. And sometimes the doctor will just immediately you should see your doctor, at least your allergist, at least once a year. But you want to make sure that you have that prescription, an up-to-date prescription at all times, and keep the epinephrine auto injectors together. And so another sort of myth buster is, well, I don't need to carry the epinephrine all the time. And so yes, you do need to carry it all the time. So that's false that you don't need to carry it all the time. And it's so true that you need to carry it, because you don't know. Of course, you're trying to do the best to strictly avoid your food allergens, but then accidents can happen, and that's why you want to be prepared. And so what I'm going to do is, I see a few questions or comments popped up here, and so I'm going to go into to these questions. So it says, are these tests available to know how likely I am to experience anaphylaxis? So as I mentioned, it's really about being diagnosed with an IgE-mediated food allergy can put you at risk for anaphylaxis. And so it's really important to get the proper diagnosis. Now, when we talk about tests that aid in the diagnosis, because again, tests don't make the diagnosis, they help to aid in the diagnosis. So you have the clinical history plus the test findings. And then your physician or your healthcare provider have to put the two together to give you an official diagnosis. And so with tests, there is testing also known as allergen component testing for foods. And so you can look at what components of the food you are allergic to. So what components of the food allergen you're allergic to. And so, for example, this is well described in peanuts. So for peanut, the food allergen components that are like RH1, 2, 3, and 6, those are known as more storage proteins. They're very stable, and they really, in a sense, know how to rev up the immune system. So that poses a greater risk of a systemic reaction, as opposed to if you were only sensitized to something like RH8, that would be a lower risk. So it's about the symptoms that you've had, plus taking that together with the test results to putting it in context. And so the risk, higher risk versus lower risk of a systemic reaction. And so, we have a question here about, how common is anaphylaxis? So that's a little bit of a difficult question to answer, in the sense that the risk is there. So it can, of course, it would be lower risk if you can strictly avoid your food allergens. But again, as I stated before, the accidents can happen. And then our final question, I find it hard to help other people understand the severity of an allergic reaction. Any tips there? And so, yes, that is an important point that we definitely want to stress. We really do have to educate people. And I think these sort of one-on-one conversations to I often get this when I'm interacting with parents, and they'll talk about other family members that may not be believing that this is a real food allergy. And we have to take a minute to say, no, this is real. The risk is real. We have to go over those signs and symptoms of anaphylaxis. And also we have to teach them about the signs and symptoms, and also how to use the epinephrine auto injector, because we all have to sort of be advocates. And so Also, another thing I think to stress when you're talking to people is that this is not a food intolerance. There's a huge difference between food intolerance versus food allergy. And again, that risk of anaphylaxis is there. So that's incredibly important and a great question to emphasize that we do have to be advocates. There are, of course, educational resources out there. The FAIR Network does a great job with producing educational resources such as food allergy emergency action plans. And so that's where your physician would sign off, and you definitely want to make sure that it's up to date every year, and make sure your physician is signing off on it. And most schools most definitely would require it. And so it's important to, practice your plan. Make sure the school is informed with or daycare with updated forms, and make sure that everyone is on the same page. And so I'll go over, in the spirit of anaphylaxis awareness next week, I'm going to go over the ABCs of anaphylaxis. We'll start off with A. A is really my mnemonic is A is for awareness, and we want to remember anaphylaxis awareness. We have to think, well, what does that mean? And it's really a severe allergic reaction to or more organ system involvement, or involvement of that respiratory system where it feels like you're not able to breathe, or you have cessation of throat closing, difficulty breathing. And then B is be prepared. So always carry your epinephrine auto injector and know how to use it. And then I talked about that emergency food allergy action plan. So make sure you're familiar with it. Keep it, a copy of it in your phone. Keep a copy on your refrigerator. And then the C, which is easier said than done, is try to stay calm, because you're going to have to remember those steps that you need to take. You're going to have to remember how to use that epinephrine auto injector. And if you panic, you can sort of go out of sequence, or you can sort of freeze and not use the epinephrine appropriately. So we definitely want you to focus on those ABCs and stay as calm as you possibly can. So with that, I am going to close it out, and thank you for tuning in for this very important topic. And share this video, this educational video, especially in the spirit of Anaphylaxis Awareness Week next week. And for more information, you can click on the video description, and it'll send you a link. That link will send you to our Allergy Insider webpage, where we have a blog providing more educational content and in more educational resources. I want you to stay safe out there, and stay tuned until the next topic. And I'll see you then. Bye-bye.